Hi, you guys. Welcome back for our daily practice questions. As always, I'd like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, maintaining a 99% pass rate for the past 9+ years. Now, I like to get into my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on what is currently being tested on the ANCC as well as AANP exam. Now, any of the videos that you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office for follow-up. The patient complains of increased stretch marks to her abdomen. Upon examination, the nurse practitioner notes purple striae to the patient's abdomen and notes that she has a round face and humped back. Based on this presentation, what is the best diagnosis at this time? Is it A, obesity, B, Addison's disease, C, Cushing's disease, or D, hypothyroidism? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it'll allow you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, based on this presentation, what is the best diagnosis at this time? Now, I tell y'all, if they're asking about a diagnosis, you need to run it back and look at the assessment findings to determine and be able to break down and figure out which differential diagnoses may potentially be your answer, right? So this patient came into the office for follow-up. She also has complained of increased stretch marks to her abdomen. Upon examination, the nurse practitioner notes purple striae to the abdomen, a round face, and humpback. Y'all know my Britney's brilliance and things I say. When I say this, you say that. Now, y'all, when I say purple striae, round face, humpback, those are classic presentation key identifiers of Cushing's disease, right? So with Cushing's disease, I say think of something that's real like cushion, fluffy, round. And that's how I picture the round face and Cushing. Whereas with Addison's, we need to add in that one. Whereas with Cushing's disease, we're in overload. We're real cush. You know what I'm saying? Question number two. When considering Cushing's disease, what is one thing that should be ruled out as the potential cause of the diagnosis? Is it A, NSAID use, B, glucocorticoid use, C, Synthroid use, or D, Tylenol use? Take a moment and tell me what you got in the comments. All right, so here, stem of the question states, when considering Cushing's disease, what is one thing that should be ruled out as the potential cause of diagnosis? So here, stem of the question is the question is stem, right? So what should you rule out with Cushing's disease? So if somebody presents just like our patient in the last question, with the purple striae, round face, humpback, you're thinking Cushing's disease, but you need to start to think of the source so you can know how to treat, right? So one of the first things you want to do is rule out any glucocorticoid use, because think about it, with Addison's disease, because we are deficient in the hormone is not producing that aldosterone and cortisol enough, we add it back in. Remember, I was saying we need to add back in the last question. So you add it back in for Addison's, right? By using glucocorticoids. So when you use this, also the use of glucocorticoids can now have you in excess of the overproduction of that cortisol, right? So that can be a common cause for Cushing's disease, because with Cushing, like I said, you're real cush, it's cushion-like, it's fluffy because you're in excess, you're in overload. That hormone, that adrenal gland is producing, they're overproducing, which is causing those increased cortisol levels and like many other things, sometimes it can be related to a medication. So may fix one thing, cause another, right? So we want to first rule out to see if they are using glucocorticoids and if that's the cause. Of course, if that's the cause, you need to remove that source. It can also be related to like tumors and different things on the adrenal gland that may be contributing, but we start from the least and work our way up, right? So first rule out if there is B, glucocorticoid use, okay? And then lastly, question number 3, the nurse practitioner has confirmed a diagnosis of Cushing's disease. What is the best treatment if surgical intervention is not an option? Is it A, prednisone, B, glucocorticoids, C, ketoconazole, or D, synthroid? Take a moment and tell me what you got in the comments, you guys. All right, so similar question states, what is the best treatment if surgical intervention is not an option? So, all right, first, if they're asking you about a treatment, you need to look and see if they have provided you with a diagnosis, right? In this event, they must have provided you with a diagnosis because they're telling you if surgical intervention is not an option, what would you do? So, yes, with Cushing's disease, most commonly, if there is a source of, like I said, a tumor or anything like that, they're going to do surgical intervention. But in the event, in a lot of cases where surgical intervention might not be something that they can do, or it may not be an option, or it may be too risky, or it may be related to other sources like excess in glucocorticoid use and things, and they need medication treatment, you need to know the treatment that is those first line therapy from that perspective. And so C, ketoconazole, helps to balance that cortisol production so that we're no longer in excess. So you want to do C, ketoconazole. That's the best treatment option with those cortisol synthesis inhibitors to help balance those levels to put you back into a normal range. We know if you didn't know anything else, you can eliminate B glucocorticoids because, as we talked about with Cushing's, you're in excess of this. You don't want to continue to add it, right? So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number one, at gmail.com. The things that I do offer is my review book. With the review book, you can get it in the ebook option or the paperback option, and they are both linked in the bio of this channel. Scroll to the top of the channel, you'll see all the links that will take you directly to it. The ebook, of course, once purchased, you have access on any device immediately. And with the other option, it'll take you to my Amazon link to purchase the book and have it shipped to you, okay, for the paperback option. What does this book entail? It's broken down by system. It is designed for family and adult gero. It is designed for both exams, including a non-clinical section that is going to go over all of those ethical terms of research, etc. It's broken down by system, as I said, short and sweet in the fashion that I always teach you guys on with the assessment, the diagnosis, evaluation, and treatment. That's the first section. Then in that system, you'll see the interactive section so that you can test your knowledge. And then there's also mini med lists associated with it too, so that you can apply those medicines with it. There's images and charts to help kind of apply it and break it down in the simplest form. I'm big on eliminating the fluff and getting straight to what you need to know and making it easier to review and retain. And then at the end, there are practice questions with rationales. So if you're looking for a quick review source, the ebook option as well as paperback option are both linked in the bio of the channel. Now, if you're somebody who prefers to review independently, something on the go, short and sweet, I have videos where I'm teaching on each system, designed for family and adult gero for both exams. Same as the book, but you get a downloadable workbook. We work through all of the systems. There's many quizzes with each system as well. And that's also linked in the bio of this channel. If you are looking to join our 5-week intensive review, this is a group review. It's broken down over 5 weeks to help you structure your study. Also get an individualized week where I do one-on-one sessions with you to tie it all together, see where you are, provide you feedback, and to tell you the next steps that you should take after completing the course. Again, this is the last one for this year. We have about 4 spaces available. So if you're looking go ahead and grab your slot while they're available. I try to keep this to a 10 student minimum so that I can be more hands-on with you, especially during that individualized week. And we do practice questions live as a group each week as well. So again, if you're looking to join, the link is in the description of this video. And then lastly, the one-on-one sessions. With one-on-one sessions, they are customized for each person. So I always say, give us a call or shoot us an email so that we can gauge what you truly need, because I offer a few things on a one-on-one perspective. If you are just really having a weak area, you can book a session for 1 to 2 weaknesses at a time. So just saying like, hey, I've really been struggling with asthma. I've really been struggling with murmurs. I just need assistance with this. So we'll book a session. And during that session, I will first teach you what it is, teach you how to work through it, and teach you ways to retain and remember it so that you're able to apply it appropriately. That's one option. The second option is an exam readiness assessment. You That's also gauged based off of the timeline that you're looking to review. It can be a session where we're working through all of the systems, and most people book that when they are within a few days of testing. Or my more detailed exam readiness assessment is broken down by system and diagnoses, and I test and gauge you in each of those areas and give you a full feedback on each and tell you areas that you need to review. Some people do that when they're more like a 2 to 3 week out portion so that they can see if they're on the right track or not. So exam readiness assessment, again, like I said, everything is customized. So it's based off of where you are and what you need. And then lastly is the custom package. That is the most popular one, where you receive a pre-test initially to gauge where you are based off of the timeline that you're looking to study. I structure a study plan for that duration of time and then work alongside with you during that time frame to take you to a successful exam attempt. Again, if you need any of the resources, feel free to reach out to the nursing studio. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.